This is a short presentation on the changes in our students' ongoing achievement records assessment in all fields. The main changes we are implementing is that mentors will be assessing the domains rather than individual competencies. These are the NMC domains. We'll have a look at those in a second. Each domain is going to be assessed in all placements for the expected level of the programme, i.e. a Year 1 student, or a Year 2 or a Year 3. Each student in each year will have different set guidance and expectations. We are changing to 3 forms of evidence required for each domain, and I'll talk about those in more detail. And we are requiring a percentage grade to be awarded for each domain and placement and year. Students' evidence store, Pebble Pad, will continue, and it is already being divided into domains for students to store. So the 4 domains I just mentioned, in line with the NMC standards for competence pre-registration nurse education, they are professional values, communication and interpersonal skills, nursing practice and decision making, leadership, management and team working. We already require students to be assessed within those domains, but we are moving away from the small component parts of competence to overview of the domain. Each domain is to be assessed in every placement. So, assessment of domains, the 3 forms of evidence that are required for each domain. One, as always, must be a direct observation. We require 1 reflection referenced to the underpinning knowledge, and it is to be related to the 3rd form of evidence. So if we look at the evidence here, again, any of these items, direct observation, question or written, for example, can be reflected upon. Mostly, students will gather reports, statements from others and evidence of products of their work. What we expect to see is inclusion and reflection on their development, having worked with somebody and gained statements, or having produced the work. Simulation, for example, you might set some scenarios for the student to work through. Let's say a scenario where they're required to look at the patient's vital signs, patient's assessments, and make decisions about actions to be taken, i.e. escalations, A to E assessment, for example, or maybe assessments around nutrition or mobility. And again, the reflection on that simulation can be written. We've introduced 2 new ones. Students, as you know, are undertaking service use reports, and any wider patient engagement activities that students might undertake can also be reflected upon. So that's 3 forms of evidence for each domain. So grading their practice. What we're going to ask the mentors to do is to grade practice from 0 to 100%. Mentors need to think about the skills, knowledge and values pertinent to the stage of the student's programme, and they should be demonstrated with the evidence that's related to that domain in the e-portfolio. I'll show you in a moment the grading grid, and we'll have a look at how that works out. Students must be given a grade of 40% to pass each domain. If a student is allocated less than 40% in any domain, action plans need to be written, and mentors, personal tutor will give guidance on how to develop the domain. Students can work on any referred domains in subsequent processes, but if a student doesn't achieve all domains in the final placement, then they'll be required to undertake a further period of practice following the exam board. Any resubmitted domain is capped at 40%. Students are allowed only 2 summative attempts at practice. So let's have a look at the grading tool. So here we have the level of performance that you would expect. So fails to meet expected performance, sometimes meets but not good enough, meet expectations, exceeds, frequently exceeds, excellent outstanding, consistent outstanding performance. Look at the grading. We're asking you to decide to give either 0 or 29%. Here Is it lower, middle or top? Lower, middle, top. Again, lower, middle, top, lower, middle, top, and so on. So you can say, actually you're frequently good, but there's room for improvement. I'm going to give you a 62 at this point. And then maybe the idea is that as a student progresses through the year, they should increase their scores, and they may then be at the upper end or even into the next. On trying testing this tool, we found that mentors found it a lot easier to make judgments about students. So we're hoping that works well for you. So let's have a look at the domains. So here's an example of our Year 1 students. Professional Values Domain 1. Here we're looking at the indicative guidance and we're looking at these items. It's your guidance to make you think about what grade you wish to give them. So we're asking you to look overall. So you may decide that they show a little bit of everything, but some better than others, which will push the grade up. Again, here's our mental health, Year 2 domain, communication and interpersonal skills. The same thing, the range of interpersonal skills that they may use. Looking at opportunities, again, you may decide that they're a middle grade within this because they demonstrate middle areas, medium areas, or could do more to improve. So the choice is yours. You may give a 50% here, or you may want to give higher. All the domains, the nursing practice and decision making, have a lot more within them. Again, some areas they may do better than others, and therefore what we're asking you to do is think of how that means in terms of overall grading. And here we're looking at the final domain for leadership, management, team working for a Year 3 student. And again, indicative guidance. Here are the areas that we're asking you to explore and to consider when undertaking assessment. So as we normally do, we would require a forms of assessment. Again, each domain, the student assesses themselves and then the mentor assesses them. What you do there at this point is discuss how things are going and where students need to go to improve, and therefore we have an action plan. What areas, what actions required, and when it's going to be reviewed. It's very standard formative assessment. Summative assessment point then, we have all of the domains. We're asking for evidence to be recorded in the same way as we have done in the past, and then we're asking for the grades for each of the domain. Student's declaration, the mentor's signatures, passing referral, the record of night shifts, and the personal tutor's signature, and the personal tutor will total the percentage of the placement, add the scores and divide by 4 to get an overall grade for that placement. So a summary of the domains achieved, if anything needs to be reassessed, the usual things around European Union directives, and here we go for a Year 3 sign-off mentor information and wider patient engagement information. If we're in placements here and students, although they may pass or if they don't pass, and there needs to be an identification of anything that needs to be taken forward into the next placement or into another assessment if it needs to be reassessed. These action plans can be very useful when moving on to another placement, and it's ideal for students to be able to summarise what they've done and completed and what action needs to be required, taking things forward. I hope this will be useful in planning subsequent placement. So let's talk about when a student doesn't pass a domain. Students have 2 attempts at practice normally. If a student is referred, they are reassessed in their next placement. If it's the end of the year, there needs to be an additional period. The reassessment will be classed as a second and final attempt unless, I apologise for that, I'm going to just put back, unless there is valid circumstances. So if a student goes down on communication and doesn't succeed in placement 1, they retake this in placement 2, but that is their second attempt. They have to undertake an assessment of all domains in all placements. The reassessed domain will be capped at 40%. Final placement referrals will mean, as we've already said, that students might need to undertake a further period if they're referred. So if you need some more information, our placement support lead within the university, personal tutors, programme leads, there's information on PebblePad or programme administration. Please ask questions when you're undertaking this for the first time. We'd rather support you to be so that you understand the requirements rather than you struggle and then go and make a mistake. It's really important, and we're very keen that our information and understanding gets over to you. Thank you for your time. And then I will say the end.